They are all caused by different viruses but can have similar symptoms. Most people who feel ill with coronavirus will have at least one of these three key symptoms. A high temperature. A new, continuous cough. A loss or change to their sense of smell or taste. So what do you need to know about other things you may catch in the coming months? Does a fever mean I have coronavirus? A high temperature is 37.8 C or above. A fever like this can happen when the body is fighting off any infection, not just coronavirus. It is best to use a thermometer to take a measure. But if you don't have one, check if you, or the person you are worried about, feels hot to the touch on the chest or back. Although fever is a key coronavirus symptom, it could be flu or a different infection. A high temperature is unlikely with a cold. What about a cough? If you have a cold or flu, you may well have a cough, along with other symptoms. Flu usually comes on suddenly and sufferers will often experience muscle aches, chills, headaches, tiredness, a sore throat and a runny or stuffed nose, along with the cough. It feels worse than a heavy cold. Colds tend to develop more gradually and are less severe, although they do still make you feel unwell. Along with a cough, there may be sneezing and a sore throat and runny nose. Fever, chills, muscle aches and headaches are rare. A coronavirus cough means coughing a lot for more than an hour, or 3 or more coughing fits or episodes in 24 hours. If you usually have a cough because of a long-standing medical condition like COPD, it may be worse than usual. You should get tested for coronavirus if you develop a new, continuous cough. Does sneezing mean I've got coronavirus? Sneezing is not a symptom of coronavirus, and unless you also have a fever, cough or loss of smell and taste, you do not need a test. Sneeze droplets can spread infections though, so catch them in a tissue, put it in the bin and then wash your hands. Remember hands, face, space to help stop the spread of coronavirus and other illnesses. Wash your hands regularly. Use a face covering when social distancing is not possible. Try to keep your distance from those not in your household. More people in different countries are being offered a free flu jab this year too in the run-up to winter. What are the symptoms? New and continuous cough, coughing a lot for more than an hour, or having 3 or more coughing episodes in 24 hours. Fever, a temperature above 37.8 C. Change in smell or taste, either you cannot taste or smell anything, or these senses are different from normal. What should I do if I have COVID? If you have a positive test result, you should self-isolate at home for at least 10 days from the time symptoms started. You must stay away from other members of your household, who must self-isolate for at least 10 days. Most people will have only mild symptoms, which can be managed with pain relief, like paracetamol, bed rest and plenty of fluids. You should not even go to a GP, surgery, pharmacy or hospital. Thanks for watching and don't forget to subscribe to my channel.